Okay, coders. So I hope you have watched the medical coding freshers most common interview Q&A part 1. So this is the continuation of part 1, which is part 2. Again, in this session also, we are going to learn most important Q&A for fresher medical coding interviews. If you want to be successful in medical coding interviews, watch this video until the end. So in part 1, we have learned until CPR, cardiopulmonary resuscitation. So this is basically the procedure for cardiac arrest. So where patient will perform chest compression 100 to 120 per minute plus rescue breaths, that is 2 ratio to maintain blood flow. So next question is part of the brain. So brain is having four important parts. Cerebrum, which is useful for thought and movement. Cerebellum, which is useful for balance and coordination, as well as brain stem, so which is useful for medulla, pons, midbrain, vital functions like breathing. Okay. Next, diencephalon, which contains thalamus and hypothalamus. Okay. So these are the parts of the brain. Next, we need to understand hemiplegia. So if you go to interview, they will ask you, what is hemiplegia? So paralysis of one side of the body, like arm plus leg due to stroke or brain injury. So tell me, have you any coder experienced any interview recently? So please mention in the comment section of this video so that if you are unable to answer any question during that interview, I can answer in the upcoming videos. So just you will mention in the comment section whether you have attended any interview or not. If you have attended the interview, please mention the what are the question you have encountered during that interview so that you are going to help other coders. So what is hemiplegia? So paralysis of one side of the body, like one side. For example, if the patient is having paralysis, so arm plus leg, only one side. If it is left side, so left arm and left leg. Okay. If it is right side, right arm and right leg. So what are the parts of an eye? So eye consists of cornea, iris, pupil, lens, retina, optic nerve, sclera, vitreous humor. So you need to remember all these things. Why means as a fresher you need to remember all these technical terms so that you will have good grip on interviews. Okay. Next question, what is glaucoma? So glaucoma is increased intraocular pressure and which damages the optic nerve leading to vision loss. Okay. So whenever there is increased intraocular pressure which damages the optic nerve. So because of the damage of optic nerve we will get vision loss. So vision loss and also we can't able to see. Otherwise you can call it as blindness. Okay. Next is what is cataract? So what is cataract? It is simple clouding of the eye lens causing blur vision which will be treated with surgery. Okay. So in the interview they will, if they ask you what is cataract? So simple clouding of the eye lens causing blurred vision. So you can't see properly. So you will see everything blur. So for that we are having surgery. Usually we will call it as cataract surgery. So using the cataract surgery, patient will perform procedure in order to treat this blurred vision. Okay. So tell me few examples for bacterial diseases. What are the common bacterial diseases? TB, pneumonia, cholera, strep and syphilis. Okay. So basically bacterial disease means these all types of diseases will be due to bacteria. Okay. So tell me what are the few viral diseases. So mention your answers in the comment section of this video. If you don't know, you can use the Google to find common viral diseases and write in the comment section of this video. Next, what are few fungal diseases? So athlete's foot, ringworm, candidiasis. Otherwise, we will call it as yeast infection. So this is one type of fungal disease. Okay. Next one is viral diseases. So here we have mentioned COD, COVID-19, influenza, HIV, AIDS, hepatitis, and measles. These are already mentioned. Other than these diseases, if you find any viral diseases, you can mention in the comment section of this video. Okay. So what is the function of CSF? Basically, we will call it as in the short form cerebrospinal fluid. So what is the function of cerebrospinal fluid? Okay. So basically, this cerebrospinal fluid provides cushion and protects brain and spinal cord, and also which provides nutrients, removes waste, as well as cushion impacts. So just try to remember, whenever you see cerebrospinal fluid, don't think that so this fluid is available in only in the brain. So cerebrospinal fluid is available in the spinal cord also, and which provide nutrients, removes waste, cushion impacts. So next question is, what are the covering layers of lung? So this is very important. So you need to know the minimum anatomy here. So what are the covering layers of lung? So pleura. So we are having three layers of pleura. Okay. So pleura is the covering layer of lung. So this again, this pleura consists of three types: visceral pleura, inner layer; parietal pleura, outer layer; and pleural space, fluid filled for lubrication. Okay. In between this visceral pleura and parietal pleura, we are having pleural space, where fluid will be accumulated. Sometimes whenever there is accumulation of fluid in the pleural space, we will call it as pleural effusion. Okay. For example, in the interview, you will tell, so what is pleural space? What is the condition, most common condition you will encounter during the coding? So you need to tell them pleural effusion. So accumulation of fluid in the pleural space is called as pleural effusion. And tell me, what are cranial nerves? So we are having 12 pairs of cranial nerves. Okay. Olfactory, first cranial nerve; optic, second cranial nerve; oculomotor, third; trochlear, fourth; trigeminal, fifth; abducens, sixth; facial, seventh; vestibulo-cochlear, eighth; glossopharyngeal, ninth; vagus, 10th; accessory, ninth; accessory, 11th; hypoglossal, 10th or 12th. Okay. Just to try to remember the names. You don't need to worry about 1, 2, 3, all these things. Just try to remember the names of these nerves. Minimum you need to remember 5 to 6 nerves. Okay. Next, clia means. So what is clia? Tiny hair-like objection or projections on cells that moves muscles or debris in respiratory tract. So most of the time you will see this cilia in the respiratory tract. These are basically hair-like projections which will move mucus and debris in the respiratory tract. So okay coders, so if anyone attended medical coding fresher job interviews, please mention in the comment section yes or no. And also if you remember any questions and answers, you can mention in the comment section of this video. So next week we are going to see part 3 of this session. And also, if you are looking for jobs in UAE, India and USA, please join in our WhatsApp group. So group link is in the description of this video. And also, if anyone looking for same day surgery coding training, IPDRG training, SCC training, CCS training, please send WhatsApp message to 707-526-3939.